So this is a training video for reported findings, going over exam and x-rays with the patient and giving care recommendations. The assumption will be that this will be a private pay or general insurance patient, and we'll review the results and give them recommendations at the end. So we start this video introducing myself. Hey Mary, it's good to see you again. Today we're going to go over the exam results with you. Before we do that, I'm going to explain a little bit about what we do chiropractically. We're going to give you a little anatomy so you have some understanding, and then we'll go over the exam and x-ray results with you, and then after that I'm going to give you some care recommendations and some treatment options. So first thing, we want to just review a little anatomy with you. Basically what we're looking at here is the pelvis and the spinal column. When we look at the pelvis, there's three main bones in the pelvis. The sacrum, the two larger bones are called the iliums, and there's two very large joints called the sacroiliac joints or SI joints. Those joints move when you walk. Your spine has 24 vertebrae in it. Right down the center of the spinal column is your spinal cord, which is very delicate, but it's very well protected by the spine. When we flip around and look at the spine from the front, what you'll see is at each level of the spine, there are a pair of nerves that come out in between the vertebrae, and those nerves are going to every part of your body. All your muscles, your organs, your glands, everything in our body is controlled by the brain, and the brain sends signals down the spinal cord out through these nerves to every part of your body to help regulate normal function and healing in the body. The other thing that you'll see in the front of the spine are the discs, which are the cushions between the vertebrae. The discs are made of cartilage, so they're flexible, which allows your spine to bend and move in different directions. The disc can become injured, so you can tear a disc and the disc bulges out, so that would be called a disc bulge or a disc herniation. The other thing that can happen to the discs is they can wear down and deteriorate, and that's what we call degenerative disc disease. Those discs basically will get thinner if there's been abnormal function at a level of the spine over a prolonged period of time. The best analogy that I could give you would be if your car hit a pothole and it knocked your front end out of alignment. If you did not realign the front end and you kept driving it like that, eventually you're going to see that your tires are going to wear down abnormally, and they're going to wear down faster than they would otherwise. So as a chiropractor, we work with what we call a subluxation. A subluxation refers to a misalignment of a joint in the body. Now our focus is the spine and pelvis, but you could have a subluxation of a knee joint or a shoulder joint. So any joint in the body can become subluxated. The subluxation basically is a very slight misalignment of the joint. So we're talking about a vertebra that just shifts slightly out of position, just a couple of millimeters, but it's enough to where it affects how that joint functions. And there's several things that occur with a subluxation. Number one, you're going to have restricted movement of that joint. So that joint's not going to move properly. The muscles connected to that joint, they're going to tighten up abnormally to try and correct that misalignment or to try and protect and stabilize the area. But the most significant thing is that these nerves that come out in between the vertebrae, they get irritated. When the nerve gets irritated, it interferes with the signals from the brain to wherever that nerve is going in the body, and that part of your body cannot function at its optimum level. So for example, the nerves in your lower neck down into your arm and hand, if those nerves get irritated, and depending on what part of the nerve is being irritated, you could have symptoms of pain or tingling or numbness, you could have weakness, you could have altered coordination, or even changes in hot and cold sensations. We have nerves that go to your organs or glands, so in your middle back, those nerves go to your stomach. If those nerves get irritated, it can interfere with how your stomach is functioning and cause issues like heartburn or acid reflux or indigestion or just upset stomach. So any part of your body can be impacted by having a subluxation that's causing stress to your nervous system. Now we do a very specialized adjustment to the top vertebra of your spine called the atlas vertebra. Okay, it sits right up underneath the skull. I would say maybe 5% of chiropractors in our profession do this specific type of adjusting. The atlas is unique in how it affects your nervous system. The atlas is the only vertebra in your spine that when it's subluxated, it can affect your central nervous system, which is the brain and spinal cord. So part of our brain called the brainstem comes out of the opening of the skull. It connects to the spinal cord at the level of the atlas vertebra. So if the atlas is subluxated, it can create stress to that part of the nervous system and actually affect how the brain is sending signals through that area to the rest of the body. So the atlas really affects the body on a global level versus all the other areas of the spine are going to affect the nervous system more locally. There are very common issues associated with an atlas subluxation. The most common ones that we see are sleep issues. So that could be difficulty falling asleep at night, trouble staying asleep through the night, or you're sleeping all night but you don't wake up feeling refreshed and rested. The atlas can cause fatigue or low energy levels. It can cause problems with balance like dizziness, lightheadedness, or vertigo. It can weaken your body's immune system. Even anxiety or depression symptoms can be impacted by the atlas. So you're going to see we do some very specific x-rays of that area, and based upon those x-rays we do a very precise adjustment to the atlas, which we'll talk about in just a few minutes. Okay? So I'm going to go over your results with you first of your exam, and then we'll go over your x-rays. So let's pull this up here. The very first test that we're going to be looking at is looking at muscle tone along your spine. So when we sit or stand, our muscles contract to a certain level just to maintain normal posture. This is an example of what a normal scan should look like. Anything that's white are areas of normal muscle tone. You want to see that that muscle tone is equal from side to side, and we'd like to see this kind of a pattern. So we should have more muscle tone in the mid-back, but less in the neck and lower back area. Now, if you see green, blue, or red areas on the scan, those are areas of increased muscle tone where those muscles are contracting more than they should be. If you see yellow, that would indicate decreased muscle tone where the muscles are not contracting enough. So let's take a look at your scan here. All right, so I'm going to zoom in here. So green is a mild increase, blue would be moderate, which we don't see, and then red is severe muscle tone. So here you see a very high reading up at your atlas, which is C1. So we've got severe muscle tension on the right side, and then down just below your shoulder blades on the right side, we also see severe muscle tension, and then a few areas down into your lower back. Now the other thing we'll see is you've got a lot of yellow in through here, so we have areas where those muscles are not contracting as much as they should be. So again, if you look at the pattern here, we can see that that pattern doesn't look like what we'd like to see as a normal scan there. Now the next one looks at imbalances of the muscles from one side to the other. So the bigger the arrow, the more imbalance there is from one side to the next. Here, at this level, we see a significant imbalance from the right to the left side, and it's actually over a 600% increase in muscle tone on the right versus the left side. And you can see most of the significant imbalances are on the right side of your spine. Now the next two tests that we're going to look at are looking at nerves that control your organs, glands, and blood vessels. So this is what we call the autonomic nervous system. And these tests really aren't going to tell us anything about where your pain is at, but they will tell us how the spine might be interfering with how your nervous system is working. And if you think of these things, these are things that your body does automatically without you really having to consciously control, like digestion or fighting off a cold or even healing a cut. Your body just does that without your conscious mind really knowing about it. So the first one that we're going to look at is called a thermal scan. And this is the one they rolled down your spine, if you recall that one. What it does is it measures skin temperature on both sides of your spine. So these little white bars, this is a normal thermal scan. The white bars basically indicate that the skin temperature is higher on one side than the other, but if it's white, it's still within a normal range. Ideally, we'd like to see just small groups of these white bars going back and forth. Again, if you see any green, blue, or red areas, those are areas of increased temperature readings that are beyond the normal range. It indicates that there's stress to the nerves at that level of the spine, and it indicates that there's going to be stress to whatever organs or glands those specific nerves are going to. So as we look at your scan, we see several areas where there's some abnormal temperature readings. Up at the atlas, so we talked about how the atlas affects the central nervous system. The atlas also affects nerves that go back up into the head, typically affecting the organs of your eyes, your sinuses, and your ears. So allergy issues, sinus congestion, problems with your vision or your eyes getting dry or watery, ringing in the ears, your ears feeling plugged or full. Those are all things that can be affected by stress on those nerves. When we go down into this area, we see nerves that are controlling your middle abdominal organs. So areas that affect your spleen, your stomach, your liver. We get a little further down to your adrenal glands and kidneys. So your adrenal glands produce hormones that help your body to deal with stress. When we get into the lower back area, those nerves are going to your lower intestines, your bladder, your reproductive organs. So lower digestive issues like constipation or diarrhea, bloating or irritable bowel, sometimes bladder issues. That could be increased urgency issues, sometimes incontinence issues, or just increased frequency of urination. For men and women, hormonal issues, and even menstrual dysfunction for women as well. So it doesn't mean that you're going to have all of those problems. I mean, this test is very fluid, meaning if I did this test again today, it would probably look different. We get concerned with the areas that show up consistently from one exam to the next. Those are the areas that there's a higher likelihood that you may have problems with those particular organs or systems in your body. This last one is where you had your fingers in the little sensors for about 3 minutes. This is also looking at the autonomic nervous system that looks at it differently. There are two parts to your autonomic system, what we call the sympathetic nervous system and parasympathetic. So our sympathetic nervous system is our body's fight or flight response. This is the mode you go into when you're in danger, you're in some type of a crisis situation. Our body also goes in that mode when we're under a lot of emotional stress. Sympathetic mode is survival mode, so it's good for short periods of time to help get you through that crisis, but it's not healthy to be in that fight or flight mode for long periods of time. Parasympathetic mode is the opposite, so this is the mode you go into when you're asleep and you're relaxing. So while you're in this mode is where your body's digesting your food, it's helping you fight off a cold or a flu. This is where your body's going to heal injured areas, cuts or sprains or strains. So if you think of the body like a heating and air conditioning system, it kicks into one mode or the other when there's a specific need for it. When there's not a specific need, we want to see balance between the two. So if you have perfect sympathetic, parasympathetic balance, you would plot somewhere right on this black line, which is in between them. The second part of this test is this scale called the Autonomic Activity Index. This gives us an idea of how well your body adapts to stress. So when we're healthy, we adapt to stress a lot better than when we're unhealthy. The higher you are on this scale, the more adaptable your body is to stress. We'd like to see at a minimum of 80 or higher here. So ultimately our goal is to have you fall somewhere in that green zone. Now on this particular test, this is where you plot it on the graph. So this tells me two things. Number one, that your body's more out of balance towards your fight or flight stress response. And you're sitting here at about 70 on this scale. So your adaptability to stress is a little bit more compromised. So certainly we like to see that moving closer to the line and higher up on that scale. There's a lot of things that factor into the outcome of this test. So your stress levels play a role, whether you eat a healthy diet or not, whether you exercise. Subluxations affecting the nervous system, especially the atlas, can really influence that as well. Okay? So we're going to go on to the next test, which is your ranges of motion. Okay, let's try that. All right, here we go. So you're going to see basically two colors on your ranges of motion. The blue is what's considered normal range of motion. The red was your ranges of motion. Okay, so if we look here, basically from here over is the range of motion in your neck. So this is flexion and extension, bending your head forward, extending your head back. And you can see 50 degrees going forward is normal. You were at 30 degrees. 60 degrees is normal going back. You were at 40 degrees. So you have pretty limited mobility in both directions. This is lateral bending of your neck, so tilting your head side to side. To the left, you're at 20 out of 45 degrees. To the right, you're at 30 out of 45 degrees. And then this is rotation, so turning your head side to side. 80 degrees is normal. You're at 50 to the left and 60 to the right. So we can see you have pretty significant limited motion in through your neck. Your lower back range of motion, this is bending forward and extending back. You're severely limited bending forward. So you're at 20 degrees out of 60, and then only 10 degrees out of 25 going back into extension. These next two are lateral bending, so your lower back bending side to side, and you're at 10 degrees in both directions, 25 degrees is normal. So some significant losses of motion. And that loss of motion is a combination usually of the joints not moving well, tight muscles restricting mobility, and then certainly pain is going to be a limiting factor. So you're not going to move further than the pain is going to allow you to. All right, the next tests we'll look at are some of the tests that we did, pressing down on your head. We did some neurological tests. Okay, so we'll pull that up here. And under normal circumstances, we press on your head and shoulders, lift your legs up. Normally that shouldn't cause pain. But if you have significant issues going on in your spine, or if you've had an injury, those particular tests are going to reproduce pain. And it's usually due to inflammation and irritation of the muscles, possibly the discs or some of the other tissue around that area. Okay. So what we can see here is that when we press down on your head in all three directions, that cause pain in your lower neck and upper shoulders. Pressing down on your shoulders also reproduce pain. Distracting your head up, actually that should give you a sense of relief. That actually caused increased pain in your neck, mid-back, even your lower back. We had several tests. If you remember, we lifted your legs up. We brought your legs up. You should be able to go to 80 to 90 degrees, which is tightness in your leg. You only got to 30 degrees on the left and 25 on the right before it started causing pain into your lower back and down into your pelvis. When we lowered your leg down and we flexed your foot back, that stretches the large nerve down your leg called the sciatic nerve. If that nerve's inflamed and we stretch it, it's going to reproduce symptoms of pain, which that did on both sides. And then if you remember, we flexed your legs out on each side, and that caused stress into your lower back and into your pelvis on both sides, even a little bit into your hip joints as well. Now the other tests that we did were the neurological tests. So if you remember, we did tests, reflex testing. We did a little pinwheel down your arms and legs to test for sensation of the skin, and then we did some muscle strength testing. The reflex testing was normal, which was great. When we did the testing with the pinwheel, though, you had changes in sensation in your left arm compared to the right arm, and in your left leg compared to the right leg, which indicates that these nerves are inflamed and they're not sensing that pinwheel equally from side to side. The muscle strength testing, you did have weakness in your left arm and in your left leg compared to the right side. So there's some decrease in your muscle strength, which again can be a result of the nerves being irritated as well. So obviously a lot going on, and obviously because you've had some trauma to your spine. So the next thing we're going to do is we're going to look at your x-rays. When we look at the x-rays, you're going to see the x-ray of the neck and lower back. There's two curves. We have a forward curve in the neck and a forward curve in the lower back. You're going to see two lines on the x-ray. So one line is drawn on the back of your spine, and the other is on what we consider the normal curve line. Ideally, we'd like to see those two lines right on top of each other. So as we look at the x-ray of your neck,
all right, we'll see. Just keep doing your maintenance.
we're going to pull this up here.
That's usually typically like you need to not today.
Okay, so this is what a normal x-ray should look like. So you can see there's a nice forward curve in the neck. The dotted line is where the ideal curve should be. The other line is on the back of your spine. And you can see that those two are very close. They're not perfect, but they're very close. The other thing you want to see are the spaces in between the vertebrae. That's where the discs are. So if you look, we see we've got very healthy looking spaces in through here. There's a little bit of decreased space in this upper area here. If we look over to the poster here, I want to show you here. Okay. So here we see examples where we see a loss of curve in the spine, in the neck and in the lower back. And that can be related to trauma, or that can be related to bad posture. In the next view, you'll actually see significant degenerative disc disease. So we can see there's a lot of narrowing of the disc here. We see a lot of bone spur formation, which is called degenerative arthritis. And that's a result of abnormal stress on the bone over a long period of time. So it's very likely that this person had some kind of trauma to their neck many years, 30, 40 years before this x-ray was taken. It takes a long time to get to that stage here. Okay, we see the same thing in the lower back, no curve, not much spacing down in these disc areas here. So as we go back into your x-ray, we can see, compared to the normal, that we do not have a good curve in through your neck here, okay? And I'm gonna zoom in here a little bit. If you look at these areas, you'll see not only do we not have a good curve, but we definitely have some narrowing of the disc spaces. So there's some degeneration of the discs. We see some degenerative arthritis, so you can see the corners of the vertebra show some bone spurring. Whereas if you look at these other vertebrae, we've got healthy looking joints up here, and right in this middle to the lower part of your neck, those joints are not very healthy. So as a result, those areas are a little bit more vulnerable if you have any type of trauma to your neck. The next x-rays we're going to look at are of your atlas. So this particular x-ray is looking at you from the back. So this is your right side, this is your left side. The atlas vertebra is sitting right here on the x-ray, and we've drawn a line through the atlas in red. So this x-ray is going to show us if your atlas is shifted to the right side or to the left side. The next x-ray you'll see looks down through the top of the skull and will show us if it's rotated forward or backwards. Okay? So on average, most people, typically the amount of misalignment is usually somewhere between neutral and 2 degrees. Based on the analysis of your x-rays, what we're seeing is that your atlas is shifted to the right 2 degrees and rotated back 1 degree. Okay? So you're at least within those averages. Now the rest of what you're seeing here is your neck and into your upper back, but we're basically going to divide your neck into an upper half and a lower half. Relative to your atlas, the upper half of your neck is shifted to the left 1.5 degrees. So it's actually compensating for the atlas going to the right 2 degrees, which is what we want to see. And then as we get down lower, it compensates back to the right in your lower neck, coming back to the right about 3 degrees. So it kind of overcorrects itself here. Ideally, you want the spine to be nice and straight. If your spine deviates, the more you deviate from neutral, the more stress you're putting on those joints and those muscles. So we want the spine to be as straight as possible here. This next x-ray is looking down through the top of the skull. So you may see that gray circle, that's the opening of the skull. And then the atlas is just this ring of bone here. So that's the one that shows us that degree of rotation back on the right side. And then here we just see a straighter view of the neck. So we see the vertebra, these little teardrops are the tips of the vertebra. You can see they kind of go left of the line, and they kind of come up and they deviate to the right of the line here. So this just gives us a clearer picture. These next x-rays are bending x-rays. So this is if somebody's had a car accident and we think that there may be some ligament damage. So these x-rays basically, as you bend forward and go back, we want to see the vertebrae all move together, but we want to see them stay together. So if you look at the red lines here, in this case you're in pretty good shape. All of these lines stay together. If you had ligament injury, we would see that the vertebrae would shift and slide, and you'd see almost like a stair step happening there. And we go back here, we actually see some ligament injury as we go back into extension. So we've got 2 areas where those red lines are not lining up with each other, okay? And so as you go back, those vertebrae are shifting, and that means there's injury to the ligaments. We'll talk about that in just a minute. This is your lower back from the side. So again, we're looking for that nice forward curve here. That blue line is what the normal ideal curve should be, and this is what your curve looks like. So you actually have a decent curve, in fact, a little bit more curve than normal, but I would rather have more curve than less curve. This is your sacrum down in through here. Now, as we look at the disc spaces in between the vertebrae, we see that for the most part, most of them look good. You've got good spacing here, up and through here and here. We do have one area where there's some decreased disc space, so you do have some deterioration of this disc. The other thing that we see is, if you can see, you kind of have that stair stepping here. This is what we call a spondylolisthesis. That's where the vertebra is actually shifted forward relative to the one below. This is usually an injury that happens when you're an adolescent, okay? The bones themselves are not completely solidified, so many times you have a hard fall. It can actually cause a break in that cartilage, which is not quite bone, and that will allow the vertebra to slip forward. So this is probably a very old injury that you had from when you were younger, and this area is more susceptible when you have any type of trauma or injury there. And then this x-ray is looking at you from the back. So we can see your right pelvic bone, your left pelvic bone. This is your sacrum here. The blue line that you see is parallel to the floor. The red line that you see here is on the base of your tailbone or your sacrum. So what we're seeing relative to neutral is that your pelvis is tilted up on the left about 1.5 degrees. Your spine should compensate and lean that way. Ideally, 1.5 degrees to help keep you balanced, but we can see it actually really overcompensates. We're at a 4-degree angle here, and it starts to make its way back to the right as we get up higher, but that's going to have to make a more gradual compensation just to keep your body upright. But again, you're deviating from that neutral position, which is going to put more stress into your spinal and pelvic joints there. Okay. If you have any questions on the x-rays, just let me know. All right, so we're going to talk about a plan of action for you. And so let's talk a little bit about your condition specifically, and then some treatment recommendations. Most people, when they come into the office, usually we find that you're going to fit into one or more categories. Either we're dealing with a new injury, something that just happened, a chronic problem that's been ongoing for 6 months or longer typically, or something that's permanent, which means we've got some permanent deterioration of your spine, some degenerative disc or joint disease, things that we're not going to be able to reverse. Our first goal with anybody when they come in, of course, is to get you pain relief. Okay, that's why people come in. They're hurting. Usually, they want to get relief as quickly as possible. Most people usually get relief within the first couple of adjustments. Sometimes the very first adjustment, you may get some relief, even if that relief doesn't last very long. The second goal is to get your spine stabilized, to strengthen your spine, and to correct your spine to the best of what your spine is capable of, and obviously the best of what we can do. And that's a process that takes a longer period of time if you choose to go through that process, and we'll talk about those options in a minute. Once we get somebody's spine stabilized and corrected, then our goal at that point in time is just to help maintain that correction. Okay, so we've done all this work to get you from here to here. Now we don't want it to regress back down. We want to be able to just maintain that. Okay, so periodic adjustments and exercises will help us to maintain that level. The best analogy I could give you here would be braces for your teeth. They put braces on, they tighten them gradually as you go through that treatment process. Usually takes a couple of years. Once you get the braces off, then you have to wear a retainer. The retainer is to help maintain that alignment or that correction. So the retainer in this analogy would be more of the maintenance type of care. Now, in your particular condition, you've been dealing with these problems for several years. So we certainly have some chronic issues, and then as you can see on your x-rays, you have some areas where there's some deterioration of the joints and the discs. So there are some permanent changes there, again, that we can't reverse, but we can hope to slow that deterioration process down. We offer 2 types of care in our office. So we offer relief care and we offer corrective care. Relief care, with our goal with relief, again, is to get you as much relief as quickly as we can. And for most people, that's usually somewhere between 2 to 6 weeks. With that type of care, I'm going to recommend coming in 2 or 3 times a week, at least for 2 weeks. And then after that, at least until you got to the point where you're getting the relief that you're looking for. At that point, you're welcome to come back on an as-needed basis. Corrective care is definitely more structured because our goal is not just relieving symptoms, but to get your spine functioning better and to get your spine healthier. We start out with corrective care at a 3-time-a-week schedule. We do that for a month. And then what we do is we redo your examination to see how you're doing symptomatically and how you're doing objectively, or how your exam is improving. If you're doing better at that point in time, we would go down to a twice-a-week schedule. And that schedule can be anywhere between 4 to 8 weeks. We would do our next assessment, and then we finish the corrective care on a once-a-week schedule. That can be 6 to 10 weeks. Again, this is all just based on how chronic your issues are, the condition of your spine, and everything else. Once we get you to that once-a-week point, or at the end of the once-a-week, we expect you're going to be about 75 to 80% of optimum improvement. That last 20-25% will take place as you start to transition towards maintenance care. So we usually do twice a month, anywhere between 3 to 6 months. And then at the end of that care, we would figure out what a good maintenance plan is. And a lot of that is depending on how well you're holding your adjustments and how good you are at doing some of the home care exercises that we give you as well. For those patients that are interested in corrective care, what I do is put together a care plan, explains what your insurance covers, what it doesn't cover, the costs of the care, and then some different payment plan options. So if you're interested in that, I can have that put together, and we'll go over that with you on your next visit. If it's just relief care that you're looking for, then like I said, we're going to schedule you 2 to 3 times a week for the next couple weeks, and then we'll go from there. Okay. Do you have any questions about anything that we've talked about today? All right, great. Let's go ahead and we'll get you moved over and get you adjusted. That's the report of findings. Okay.